Okay, so we're back for another deep dive, and wow, this time you guys really sent us a pretty amazing collection of stuff. We've got, let's see, Hospice Palliative Care Treatment.pdf, Hospice Psychosocial Guidelines 2012.pdf, Palliative Care Brochure.pdf. I mean, the list goes on. It's fantastic. Podcast draft about psychosocial palliative care.pdf, principles of psychosocial palliative care.pdf, even psychosocial therapists in palliative care.pdf, Simitam plus MX plus PDF.pdf.
And a summary of psychosocial palliative care guidelines.pdf and standards-palliative end-of-life-care.pdf. Quite a collection.
It is a really rich set of resources for us to dig into. And, with all this material, what we really want to explore today is the super important role of psychosocial therapists in palliative care.
Absolutely. And I think what's so crucial here is we're going beyond just the medical aspects, right? We're talking about the whole person.
Exactly. It's about addressing the emotional, the social, even the spiritual suffering that patients and families are going through, when they're dealing with a life-threatening illness.
Yeah, it's really about recognizing that suffering isn't just physical. It's this whole interconnected experience. And that's where psychosocial therapists come in, I think. Like if we look at the Hospice Pal Care Treatment.pdf, it really emphasizes that palliative care is holistic.
Right. It's not just about treating the disease. It's about treating the whole person.
Exactly. And that means taking into account their emotional well-being, their spiritual needs, the social challenges they might be facing, all of it.
Absolutely. So in this deep dive, we're going to zoom in on how these therapists, how they use their expertise to ease suffering, manage pain, address all these things, but not just through medication.
Right. It's about going beyond the purely medical interventions.
Exactly. And it's interesting, the Hospice Palliative Care Treatment.pdf also points out something that I think is really important, and that is palliative care training. It's not just for doctors, right?
Oh, absolutely not. It's designed for a whole range of healthcare professionals. You have your medical officers, nurses, clinical nurse practitioners, and then social workers and allied health professionals too.
Right. So understanding this stuff, it's crucial for pretty much everyone involved in a patient's care.
Yeah, and it highlights that this kind of care, this truly comprehensive care, it really requires a team approach. Everyone needs to be on the same page, understanding and valuing the different dimensions of what a patient is going through.
I totally agree.
Right.
Okay, so let's get down to the basics here, the foundation. Both the Hospice Psychosocial Guidelines 2012.pdf and the Principles of Psychosocial Palliative Care.pdf, they really emphasize communication and counseling. It's like that's the core of everything.
It really is. I mean, think about it. Communication. It's how we connect, how we build trust, how we understand each other, especially in palliative care where the stakes are so high, where emotions are so intense. Communication is everything.
So it's not just about giving medical updates or talking about treatment options.
No, it's much deeper than that. It's about creating a space where the patient feels truly heard and understood. It's about clarifying their goals, their values, what's important to them. It's about helping them to identify what they're struggling with, but also their strength, the things that give them resilience. And, it's about exploring what gives their life meaning, even in the face of this illness.
Wow, that's powerful. So you're really tapping into their whole inner world, their beliefs, their hopes, their fears.
Exactly. It's about recognizing that a person is so much more than just their diagnosis.
Absolutely. And I think it's really helpful that the Hospice Psychosocial Guidelines 2012.pdf actually lays out some specific criteria for ethical and effective communication in this context.
Yeah, those are really valuable guidelines. It needs to be timely, the information needs to be accurate, but it also has to be understandable to the patient. And, it has to be delivered with gentleness, respect, and a lot of compassion.
That makes perfect sense. Because when you're dealing with, potentially life-altering news, the way it's delivered can make a huge difference in how someone copes.
Absolutely. And one of the most challenging aspects of communication in this field is breaking bad news.
Oh, absolutely. It's got to be one of the toughest conversations to have.
It is. And the guidelines actually recommend using a specific framework for these conversations. Robert Buckman's 6-step protocol outlined in the Hospice Psychosocial Guidelines 2012.pdf.
Okay, let's break those steps down. Step 1 is getting started. What does that actually involve?
Well, it's all about setting the stage, creating the right environment for a sensitive conversation. So whenever possible, you want to do this in person, not over the phone, And privacy is key. Make sure there are tissues handy and that you won't be interrupted.
So it's about making the person feel comfortable and safe.
Exactly. Even small things like sitting down so you're at eye level with them, using their preferred name, introducing yourself if you need to. These things can really help to ground someone who's about to receive difficult news. And explicitly saying, hey, I've got time for you, we won't be interrupted, that shows you're really present and dedicated to this conversation.
Those are great points. Okay, step 2 is finding out how much the patient knows. So how do you approach that?
It's about really listening,
Yeah.
really trying to understand their perspective. You might ask open-ended questions like, what have the doctors told you so far? Or what's your understanding of your illness right now? And it's important to pay attention to their tone, their hesitation, even what they might not be saying.
So you're trying to gauge how much they already know and how they feel about it.
Exactly. And their body language can tell you a lot too. Are they making eye contact? Are they fidgeting? Are they withdrawn? It all gives you clues about their emotional state, whether they might be in denial.
That makes sense. Okay, step 3. This one seems tricky. Finding out how much the patient wants to know.
Yeah, this is where you have to be really sensitive because not everyone wants to know all the details, right? Some people might want to know everything, while others might prefer to just get a general overview.
So how do you figure out what they want?
You can ask directly, but gently, like, are you someone who likes to have all the information, or would you prefer me to just give you the main points? And if they say they don't want to know more, you have to respect that. But you also want to let them know that you're there for them if they change their mind, if they want more information later on.
It's about giving them control over the information they receive. Okay, step 4, sharing the information. This is where it gets really heavy.
It is, and the guidelines stress the importance of starting from where the patient is, reinforcing anything they already understand correctly. And you want to use their language, their terms as much as possible. You're gently guiding their perception towards the medical reality.
So it's not about dumping a bunch of medical jargon on them.
No, absolutely not. You have to be clear, simple, avoid jargon, and deliver the information in small chunks. And it's super important to check for understanding, am I making sense? Do you have any questions? Because when someone is receiving bad news, their ability to process information can be really affected.
So it's about pacing yourself, giving them time to absorb what you're saying.
Exactly. And knowing when to pause, you don't have to say everything at once.
Okay, step 5, responding to the patient's feelings. This is where the psychosocial support really kicks in, I imagine.
It does. This is where you really need to be present emotionally, to just listen and validate their feelings, whatever they may be. It could be shock, anger, sadness, fear, denial, whatever comes up.
And no judgment, right?
None at all. Sometimes the best thing you can do is just be there, offer a tissue, maybe some gentle physical touch if it's appropriate and welcome. Just let them know you're there with them.
So it's about holding space for them to process those intense emotions.
Yeah. And the guidelines actually caution against trying to fill the silence with explanations or giving false reassurances, like saying everything will be okay. Because it won't be okay, necessarily.
Right. So what do you say?
Focus on empathy. Acknowledge their feelings. You could say something like, this must be so hard to hear. Just let them know that their feelings are valid, that you understand the weight of what they're going through.
That makes so much sense. Okay, last step, step 6, planning and follow through. Even in this difficult situation, it's about building hope, right?
Absolutely. Hope might look different now. It might not be about cure anymore, but maybe it's about comfort, meaningful time with loved ones, or good symptom management. This step is about working together, identifying the patient's immediate concerns, figuring out what can be addressed, what can be improved.
So even in palliative care, there's still a lot that can be done.
Always. Even if it's something small, like making sure they have a warm blanket or helping them manage a specific symptom, it all makes a difference. And it's crucial to remind them of their own coping skills, the things that have helped them in the past, and connecting them with support resources, summarizing what you've discussed, allowing for more questions, and setting up a clear plan for follow-up care. All of that contributes to a sense of hope and knowing that they're not alone.
That's such a crucial message. Now, beyond this initial communication, the guidelines also talk about the importance of psychosocial assessments. What do those involve?
They're much broader than a typical medical history. It's about understanding the whole person, So you look at their family structure, their living situation, financial resources, their cultural background, their spiritual beliefs, the quality of their relationships, their emotional well-being. It's really comprehensive.
Wow, so it's not just about their physical health. It's about everything that impacts their life.
Exactly. It's about seeing all the pieces of the puzzle, how they fit together, and how they might be affecting their experience of illness. And the Hospice Psychosocial Guidelines 2012.pdf actually mentions that social workers often play a lead role in these assessments.
That makes sense, given their expertise in social and emotional dynamics. So once you've done this assessment, what kind of support can a patient and their family actually receive? What are the interventions?
Well, it really varies depending on their needs. The Hospice Psychosocial Guidelines 2012.pdf, the Principles of Psychosocial Palliative Care.pdf, and the Psychosocial Therapists in Palliative Care.pdf all highlight a wide range of interventions. Some are very practical, like helping with financial aid applications, connecting them with community services, maybe even assisting with funeral arrangements.
So tangible help with everyday life stuff.
Yeah, exactly. But then there are also more emotional and spiritual interventions, like helping families to facilitate end-of-life rituals that are important to them, or, helping patients to resolve conflicts, say goodbye to loved ones, express their love and gratitude.
That's so important. Making peace with things, tying up loose ends.
It is, and it's crucial to remember that everyone's different, right?
Right.
You can't assume anything based on someone's background. You have to really listen and respect their individual wishes and preferences.
Absolutely. The guidelines also mention something called life review. What is that exactly?
Life review is a powerful tool, It's about helping patients to reflect on their lives, to identify the things that have given them meaning, purpose, even a sense of legacy. Sometimes just having someone listen attentively as they share their story can be incredibly therapeutic.
So it's not just about remembering the past, it's about finding meaning in it.
Exactly. It can help them to find peace and make sense of their life's journey, even as they face the end of their physical life.
That's beautiful. And what about, the things people haven't done yet, the dreams they haven't fulfilled? That must be a source of distress.
It often is. And, the guidelines remind us that grief can start at diagnosis. It's not just something that happens after death. So patients might be grieving those unfulfilled dreams, those things they won't get to do.
So what can you do about that?
Well, you can help them to identify those wishes, those things that are most important to them, and then explore ways to maybe still make some of them happen. Sometimes it requires creativity, flexibility, maybe even bending the rules a little bit.
So it's about advocating for them, finding ways to honor their wishes even in difficult circumstances.
Exactly. And it's especially important with younger patients, parents who are leaving young children behind. Maybe you can help them to create messages for their kids. Letters, videos, recordings, things that will bring them comfort and guidance in the future.
Those are such precious gifts. And what about older patients? Do they need the same kind of support?
Absolutely. It's important not to make assumptions, to think that just because someone is older, they're somehow ready to die. They still have losses to grieve, they still need support, and they need to be actively involved in decisions about their care.
It's about treating everyone as individuals, recognizing their unique needs and wishes. Now, another big area in palliative care is loss, grief, and bereavement.
Yeah, and the Hospice Psychosocial Guidelines 2012.pdf and the Principles of Psychosocial Palliative Care.pdf, they both really emphasize that grief is a natural response to loss, and it can start way before death actually happens.
Right, as we were just saying, it can start a diagnosis.
Exactly, and it's not just emotional, it can manifest in physical symptoms, cognitive difficulties, changes in behavior. It affects the whole person.
And of course, the grief continues for the family and loved ones after the patient passes away.
Of course. And that's where bereavement support comes in.
Now, the guidelines talk about assessing for complicated grief. What does that mean? What are the risk factors?
Well, some losses are just harder to cope with, Things like a sudden death, a traumatic death, the death of a child. Those can be especially difficult. And then there are personal factors too, like lack of social support, previous mental health issues, or a complicated relationship with the person who died.
So you're looking for those red flags, the things that might make someone more vulnerable to prolonged grief.
Exactly. Because if you can identify those risks early on, you can provide more targeted support.
That makes sense. So what kind of support do you offer to bereaved families?
It depends on their needs, of course. But it can be practical things like helping them with funeral arrangements, explaining legal and financial matters, connecting them with community resources. And then there's the emotional support, just being there for them, listening to them, validating their feelings.
Letting them know it's okay to grieve, that there's no right or wrong way to do it.
Exactly. And reassuring them that their reactions are normal, that they're not alone. Educating them about the grieving process can be really helpful too, and then connecting them with counseling or support groups if they need it.
So it's about providing a whole network of support, helping them to navigate this incredibly difficult time. Now let's shift gears a bit and talk about cultural sensitivity and spiritual care in palliative care.
These are such important aspects, the Hospice Psychosocial Guidelines 2012.pdf, the Principles of Psychosocial Palliative Care.pdf, and the Standards Palliative Endo-Life-Care.pdf. They all stress how crucial it is to be culturally sensitive.
Because everyone experiences illness and death differently.
Right.
Culture shapes our beliefs and our practices.
Absolutely. And it's so easy to make assumptions based on our own background. So it's really important to be aware of those potential differences, in language and customs and how people express their grief in their religious beliefs.
Right. What might be comforting to one person might be completely inappropriate for another.
Exactly. So you have to be really attentive, really listen to the patient and their family, and try to understand their unique perspective.
It's about honoring their individual and cultural beliefs. And speaking of beliefs, the guidelines also talk a lot about spiritual care.
Yeah, and that's not just about religion. It's about meaning, purpose, connection, those big questions that we all grapple with.
So how do you approach spiritual care in palliative care?
Well, there's a tool called the FICA Spiritual Assessment, mentioned in the guidelines, that can be helpful. It stands for faith or beliefs, importance or influence, community, and address. So you're exploring what the patient believes, how important those beliefs are to them, whether they're part of a spiritual community, and how their spiritual needs can be addressed in their care.
So you're creating a space where they can talk about these things openly without judgment.
Exactly. And it's important to be respectful of all beliefs, whether they're religious or not, and to be aware of any taboos or sensitivities, things that might be offensive or upsetting to them.
Right, because the goal is to provide comfort and support, not to cause more distress.
Absolutely. Now, the summary of Psychosocial Palliative Care Guidelines.pdf also talks about managing psychosocial emergencies. What are those? What kind of situations are we talking about?
Okay, so these are urgent situations, right?
Yeah.
Things that need immediate attention.
Exactly. The summary mentions a few key areas. First, there's suicide ideation.
Oh, wow. That's obviously a huge red flag.
It is. And if you encounter that, you need to assess the risk factors immediately, provide support, and potentially refer them for a psychiatric evaluation. Then there are social emergencies.
What would that look like?
Things like, a family that has absolutely no money for funeral arrangements. Or maybe a patient who's a single parent and their children are now going to be orphaned.
So those are situations where you need to step in and provide immediate practical help.
Exactly. You need to mobilize resources, connect them with social services, whatever it takes, and then there are existential crises.
It sounds pretty intense.
It can be. This is when people are really grappling with those big questions about life and death,
Yeah.
What's the meaning of it all? Why is this happening to me?
So it's a spiritual crisis, essentially.
You could say that. And in those moments, the most important thing is to just be present with them, to listen without judgment, to validate their feelings, and to maybe connect them with a chaplain or a spiritual advisor if they're open to that.
It's about offering comfort and support in those darkest moments. Now, I want to talk more about the actual therapies that psychosocial therapists use. The psychosocial therapist in palliativecare.pdf talks about a lot of different approaches.
Right. And this is where their specialized training really comes in. They're using evidence-based therapies that have been shown to be effective in helping people cope with stress, anxiety, depression.
So what kind of therapies are we talking about?
Well, the document specifically mentions cognitive behavioral therapy, or CBT, acceptance and commitment therapy, or ACT, and narrative therapy. These are all approaches that can be really helpful for palliative care patients.
Can you give some examples of how they're used?
Sure. So with CBT, the focus is on identifying and changing negative thought patterns and behaviors. So for a palliative care patient, that might mean helping them to challenge their fears about the future, or to develop coping mechanisms for sadness and anxiety.
So it's about giving them practical tools to manage their emotions.
Exactly. And then with ACT, the emphasis is on accepting those difficult thoughts and feelings rather than fighting them, and then focusing on taking actions that are consistent with their values.
So even though their situation is really tough, they can still find ways to live a meaningful life.
Right. It's about finding that balance between acceptance and action. And then narrative therapy is all about helping people to reauthor their life stories, to focus on their strengths and their resilience.
So it's about helping them to see themselves in a more positive light, even in the face of illness.
Exactly. It can be very empowering. And the psychosocial therapist in palliativecare.pdf also emphasizes spiritual and existential care.
We talked about that a bit earlier, right?
Yeah. But this document really dives into the specifics, helping patients to explore their meaning and purpose, to connect with their beliefs, to address their concerns about mortality and legacy. And it often involves working closely with chaplains and other spiritual advisors.
So it's about helping them to find peace and make sense of what's happening to them on a deeper level. And the document also talks a lot about family support, right?
Absolutely, because palliative care doesn't just affect the patient, it affects the whole family. So therapists provide education, support, and counseling to family members as well.
What kind of things do they help families with?
Well, they might educate them about the illness and the dying process, so they're better prepared for what to expect. They help them to cope with their own emotions because it's incredibly stressful to watch a loved one go through this. And they facilitate communication within the family so everyone can talk openly and honestly about what they're going through.
Because families often struggle to talk about these things,
So,
right? There's so much fear and sadness.
Exactly. And then, of course, therapists also provide grief counseling and bereavement support to families, both before and after the patient's death.
So it's about recognizing that the family is going through this journey too, and they need support every step of the way. Now, I thought it was really interesting that the document also talked about integrating psychosocial interventions into the management of physical pain and symptoms.
Yeah, that's a really important connection because we know that our mental and emotional state can have a huge impact on how we experience pain.
So how does that work in practice?
Well, the psychosocial therapists in palliativecare.pdf and the Symptom plus MX plus PDF.pdf both mention techniques like relaxation exercises, mindfulness, and guided imagery as being helpful for pain management.
So those are things that can help people to calm their minds and bodies, which in turn can reduce pain.
Exactly. And they can also help with anxiety, which we know can make pain worse. And there's even some evidence that these techniques can be helpful for nausea.
Wow, that's fascinating. So it's not just about medication. It's about tapping into the mind-body connection to find relief.
Right. And those are just a few examples. There are lots of other non-pharmacological comfort measures that can be really helpful.
Like what?
Well, the psychosocial therapist in palliativecare.pdf talks about humor, for example. Of course, you have to be sensitive and appropriate, but sometimes a little bit of laughter can go a long way in easing tension and bringing a moment of joy.
It can be such a release,
Yeah.
to be able to laugh even in the midst of sadness.
Absolutely. And then there's gentle touch, which can be very comforting for some people. Again, you have to be mindful of boundaries and make sure it's okay with the patient.
Right. It's about respecting their comfort level. And what about the Symptom plus MX plus PDF.pdf? Does it have any practical tips?
Oh, it's full of them. For nausea and vomiting, it suggests things like making sure the patient is well hydrated, stopping any medications that might be contributing to nausea if possible, minimizing strong smells, especially from cooking, offering bland foods, cold foods, and making sure they have good mouth care.
Oh, those are all pretty simple things, but they can make a big difference.
They can. And it also recommends giving them small, frequent meals rather than big ones and elevating their head after eating. And then, of course, there are complementary therapies like relaxation that can also help with nausea.
So it's about taking a multifaceted approach.
Yeah.
Using a combination of strategies to manage those symptoms.
Exactly. And the document also has specific recommendations for managing breathlessness and delirium.
What are some of those?
Well, for breathlessness, it suggests creating a calm and well-ventilated environment. Maybe using a fan to circulate the air or putting a cool cloth on their forehead. Positioning is important too, making sure they're in a comfortable position that makes it easier to breathe. And then there are breathing exercises they can do, like pursed lip breathing. And then for delirium, which can be really scary and confusing for both the patient and the family.
Oh, yeah, I can imagine.
The focus is on managing the environment, making sure it's safe and uncluttered so they don't fall or hurt themselves. You want to provide orientation cues like clocks and calendars to help them stay grounded in reality. And it's important to have a calm and consistent presence, to speak clearly and simply to reassure them.
So it's about reducing stimulation, making them feel safe and secure.
Exactly. And supporting the caregivers is crucial too, educating them about delirium and giving them practical strategies for managing it.
It's all about teamwork, right? Everyone working together to provide the best possible care. Now, I want to touch briefly on the Standards Palliative End-of-Life-Care.pdf. This document outlines the professional standards for social workers in palliative and end-of-life care.
Yeah, these are really important guidelines. They cover a lot of ground, from ethical principles to specific competencies. It's about ensuring that social workers are providing high quality, compassionate care to patients and families.
So what are some of the key standards?
Well, first and foremost, it's about adhering to ethical principles and professional values. That's the foundation of everything. And then, they need to have a deep understanding of the biopsychosocial aspects of palliative care. They need to be able to conduct thorough assessments, develop individualized care plans, and advocate for their patients.
So it's not just about being nice and caring. It's about having the knowledge and skills to actually provide effective care.
Exactly. And it's also about self-awareness, empathy, cultural competence, teamwork, documentation, ongoing professional development. It's really a comprehensive set of standards.
It really highlights how complex and demanding this work is and how much expertise social workers bring to the table.
It does. And I think it's important to remember that social workers are just one part of the palliative care team.
Mhm.
They work closely with doctors, nurses, chaplains, and other professionals to provide truly holistic care.
It's about recognizing that everyone has a role to play in supporting patients and families through this incredibly difficult time.
Exactly. And it's about going beyond just the medical aspects.
Mm.
It's about recognizing that suffering is multifaceted and that we need a multifaceted approach to address it.
And that's really what this deep dive has been all about, exploring all those different facets of care.
It has. And it's been fascinating, hasn't it? Seeing all the different ways that psychosocial therapists can make a difference in people's lives.
It really has. And I think it leaves us with a lot to think about. How can we apply this knowledge in our own work?
Yeah.
How can we advocate for more holistic, more compassionate care for those who are facing serious illness?
Those are great questions. And here's another one for you to ponder. If we truly embrace this interconnectedness of mind, body, and spirit, how might that transform the experience of palliative care, both for the patients and for those who love them? It's something to really consider.